Hello everyone and welcome back to Clinical Cousins YouTube channel, where today we're going to go over the functions of different types of blood vessels and how blood flow is controlled, and the concept of resistance, which is super important in managing any patient that you have who is critically ill or has fluctuating blood pressure. So first off, what is a blood vessel? Well, quite simply, it's a vessel or a passageway or a conduit for blood to move from one point to another. And of course, we know that this is usually a closed system. So once blood is squeezed from the left ventricle, it moves into our largest artery. We call this the aorta. So the aorta is sort of a candy cane shaped vessel that receives the entire cardiac output, meaning all of the blood that is pumped from the left ventricle per minute. And so this is about 5 liters per minute. This is a ton of blood. So we can see that the aorta, the big aorta, is actually then divided into different arteries. So what do these arteries look like? What are they like? Well, we have to know that arteries are a little bit stronger, thicker, and tougher than, say, our veins. And this is because they have to withstand a lot of pressure. So because the arteries are under a lot of pressure or stress, we call the arterial blood stressed volume. So if you can think that when you're about to take a test, you feel like you're under a lot of pressure, you say that you're stressed. This is the same exact concept. And this is actually what we're measuring with our blood pressure cuffs. So when the blood is in the arterial system, it is under a lot of stress or pressure. We know that this is called stressed volume. This is a very important concept that we'll talk about later. But we should also know that there are very important little ends of arteries called arterioles, literally little arteries. So these arterioles, they come just before capillaries, and they are densely peppered with alpha-1 receptors. We know that if we remember from our previous videos, alpha-1 receptors are involved with vasoconstriction. So when we stimulate these receptors, the arterioles, they clamp down, which raises our blood pressure. And this is so vitally important that our body does this. So interestingly, the arterioles in our skeletal muscle, actually, they have beta-2 receptors, which become activated and dilate our vessels when we are exercising. And because when we open up our little arteriolar blood vessel straws, that skeletal muscle can now have more access to blood, and therefore it can perform better, because we know that the main function of the cardiovascular system is to deliver fluid and nutrients to our cells. So let's talk about capillaries, the things that I've drawn here in green. So capillaries are very thin-walled. In fact, they're only one endothelial cell thick. So they have the very important job of exchanging fluid between our blood vessels and our cells. In fact, this is why they are so thin. Diffusion can happen so quickly in capillaries because substances don't have to get through the very thick vessel wall to get to where they need to be. So in simple terms, fluid is pushed out of the capillary after it leaves the arteriole, and then it bathes the cells. So this fluid that's in the arterioles, it is pushed out, and then it bathes the cell in the fluid, and then conveniently it is sucked back into the capillary about right here near the venule side. So there are many different types of capillaries, and you can tell by how holy they are. That's how we tell them apart. And I'm not talking about how much they go to church. I'm talking about how much space is in between the endothelial cells. So the glomerular capillaries, so think in our kidneys, they have the largest holes. So if this was an endothelial cell, this was an endothelial cell, they have really large holes. They have a lot of separation in between them. So the capillaries in the systemic and pulmonary circulations have about average size holes, and then the capillaries in the brain have virtually no spaces between the cells because of tight junctions and astrocytes, or really the foot processes of astrocytes, but those tight junctions are a little bit more important. So these tight capillaries in our brain, it's actually called the blood-brain barrier, and it's the reason why only fat-soluble drugs can actually cross these really tight spaces. They can actually go through the cells, while water-soluble drugs cannot. They can't make it through those clefts. So it is important to know, I believe, that not all of our capillaries are perfused at the same time. I can see this one's perfused and this one's not. Now, our blood pressure is maintained because some of the blood vessels are closed and others are open. So if everything were open all the time, then there would be almost no pressure to make the blood move. So now let's talk about venules. So these are just after capillaries, and they're thin still, but they're just a little bit more stretchy. So they can hold a lot of blood without generating a lot of pressure. So we say that they're very compliant. And after venules, we have veins. So these are large and very stretchy vessels. So that means that they can hold a lot of blood without much pressure. So we say that these veins are compliant. So because the blood in the veins, they don't have much pressure, we say that they are not stressed. Therefore, we say that the blood in the venous system is our unstressed volume. Remember, the veins are like very, very good hosts. You can do whatever you want in their house, but they're very compliant. They're gonna let you do it. They're not pressuring you to act a certain way. So that's why we call venous blood unstressed. When we take our blood pressure, we are not measuring the venous blood. So an interesting fact is that these veins actually have alpha-1 receptors as well. So when these receptors are activated, the veins squeeze their blood and it'll actually get dumped over into our arterial stressed volume. So this is a way that we can increase our blood pressure, but more on that later, but I thought it's interesting that you should know that. Now, we have the basics down. Let's talk about a concept, velocity. So velocity is how fast the blood is moving through our vessels. And you're saying, why is this important? You'll see in just a second. Velocity is flow over area. So I used to get really scared when I saw equations, but I don't anymore, because all you have to do is just see how they work. Test it out in different scenarios so it makes sense to you. So simply put, the speed, the velocity of the blood will increase when there is more blood flow, and it will decrease when there is more area. So if we had a lot of blood volume, we had a whole river full, and we shot it through a really small area, a little tiny blood vessel, that blood would move really, really fast. And we all know this because we've all put our fingers over hoses. And when we do this, the water shoots out really far and fast, right? This is how we used to spray people, because the velocity is so much. Now, on the contrary, on the flip side, if we just had a very small amount of blood that was moving through a really big, wide vessel, say like a big fire hose, but we only had, say, maybe a cup of water, then it would just dribble out, wouldn't it? It wouldn't move very fast. Now, why is this important? Why is this an important concept for us? Well, picture this. If we take the whole surface area of the aorta, if we say, how big is the aorta? We say it's this big. And if we added up all of the arteries, we took their diameters, added them all up, and we say that it probably came out to about this big. Now, if we do this with the capillaries, we add up all of the surface area of the capillaries, it might turn out to be this big. Now, let's see how fast the blood moves. If I told you that the blood in a tiny capillary moved slower than the blood in the big aorta, you would say, but Christian, I thought that if the vessel was really tiny, it would shoot out really fast. I would say, well, you're correct, but you're also forgetting that there's just one aorta, and then there are tons and tons and tons and tons of these capillaries. So when we add up all of the surface area of all the capillaries, we can see that their surface area is actually very, very large. This makes the velocity slow. Now, this is an important point. Because the combined area of all the capillaries is so large, the blood actually moves through the capillaries really, really slow without much velocity. And this is perfect. We want the blood to move very, very slowly through the capillaries because it gives the blood time to dump their nutrients off at the cells, to bathe the cells, and then it also gives them the blood time to pick up the waste products and then pull them back into our capillaries near the venule side. Okay, so we talked about area. Now, what about flow? Well, it's important to know that flow, they depict it here as Q, is pressure over resistance. This is such an important concept. So this concept tells us how to move blood throughout our body. It's arguably one of the most important concepts in cardiovascular physiology. So flow, I want you to think of it as blood movement, and pressure is what drives movement. I will say that again because it is so important. Flow is blood movement, and pressure is what drives that movement. When blood leaves the left ventricle, it has about, say, 100 millimeters of mercury. It has 100 pressure, to be exact. And this blood, it loses pressure as it goes through our arteries, as it goes through our arterioles, and it loses so much that when it actually ends up in the large veins, the vena cava, the pressure is actually about 0. But what is pesky resistance? What is that resistance? Well, resistance, we can think of it, this stops movement. This stops our flow. Now, if our arterioles were clamped all the way down, we know that there would be no blood flow. Blood cannot move if there is maximum resistance, if there is no way for the blood to get through. So what controls our pressure? What drives our pressure? Well, we know that it's mainly our pump, our heart. And what controls our resistance? Very important, mainly our arterioles, because we remember that that is the area of the highest pressure gradient. We know that the arterioles, they have alpha 1 constrictors. We know that that is the area where we're going to control our resistance because they're going to be able to clamp down. Now, I know all of this is a lot of information, but I hope that now the big concept of hemodynamics is making just a little bit more sense. And as always, thank you for taking the time to learn with us today, and I hope that you like and subscribe for more content. Thank you.